Everybody wants to be the best that gets into a profession or does something, and that's what we strive. We want to be the best. Anything we can get better on, we want to do, and if it's extra hours, it's extra hours, because it's important when someone walks in here, they know they're going to get the best care, and we're going to find the cause of their problem.
Especially in the last couple of years, we've changed so many things about this office. When you see the difference in terms of one-on-one experience that our patients get, when you see the fact that we've got multiple doctors all working together to try to get you the best results possible, I think immediately you come into this environment and you're like, oh, this is not at all what I expected. You don't get to go to most doctors' offices, talk to one doctor, come out into another room, talk to a different doctor. Sometimes we'll have patients who work with 3 different doctors on the same day, all working towards improving their chief complaint, trying to make sure that their life is improving and that we're not hitting the roadblocks that sometimes will get in the way.
It's very unique because most of the time you don't go into a chiropractic office or a rehab office, a physical therapy office, where you've got 4 or 5 different techniques you can use, whether it be corrective exercise, manual therapy, dry needling, manipulative technique of the spine or the joints, what have you, to be able to get a patient better. We have a lot of tools here that we can use, and we make sure that it's patient-centered. I mean, we do a video capture with everybody that comes in. So I mean, a picture is worth 1,000 words. A video might be worth 1,000,000 words when you can look through everything and kind of see, well, you couldn't do this squat before, you couldn't reach this arm behind your back before, and now all of a sudden, look. I want people to be able to discuss, you know, what actually we're doing here. I can throw medical jargon at them, but that's not cool. I wouldn't want that if some computer guy did that to me. I mean, I want to know what is the problem in my terms. You know, how can I understand it? Inevitably, someone's gonna ask, well, why are you going there? And if you can't explain it, then as a practitioner, I've failed. Because I want you to be able to explain why you're coming in here and how we're helping you.
The difference that I've noticed in my experience at other clinics and what we do here is we try to do a lot of education on our first day. We don't always treat our patient on the first visit, and the reason why we don't is because we do a lot of explanation and we have a chance to sit down and talk about what it is that we do, what we're looking for, what's going through my mind as I'm doing an exam with someone, what the best therapies for that person is, and it allows us to break down that barrier that people have. I think our emphasis on the physiotherapy, the soft tissue work, the myofascial work that we do is incredibly important to the overall outcome of our patients, and I think that's what makes us different.
I think sometimes people take it as a job that do what I do for a living. I like getting people better. I like seeing people do crazy things at the gym that they couldn't do before because now they feel good. And I think most of the people that are in here understand what we're after and what we're trying to do, and that's just improve how you move, how your health is. Because the better you move, the better you're gonna feel. And you're able to exercise without pain, and you're able to do things with your kids without pain. And that's really the motivating factor for most of us. Is I mean, I have a lot of new parents in here, and they want to be able to play with their kids into their 50s and 60s. This is a great way.
We've been working with the Barrington Food Bank for the last 8 years. So if you bring us 2 cans of food, your re-exam or your first visit is completely complimentary.
We do about 250 to 300 pounds a month. But that allows people to come in and get basically assessed for a donation, and they can check out the office.
We don't want people to feel like we're trying to force them to come in the door. We want them to walk in and not feel pressured about it, because honestly, we're only here to help them.